Okay, let's embark on a deep dive into something absolutely critical for our equine athletes,
Hmm.
the fetlock joint.
Mm-hmm.
Horses are just magnificent, truly incredible athletes capable of immense speed, power, agility.
They really are.
But this very athleticism, this extraordinary design, it places immense, almost unbelievable stress on certain parts of their body.
Yeah, huge forces involved.
And arguably, no joint bears more of that burden than the fetlock.
That's absolutely right. For this deep dive, we're taking a close look at all your notes and research materials to understand, diagnose, and, well, most importantly, manage the complex diseases that can affect this crucial joint.
Right.
Our mission today is really to cut through the complexities, sort of distill the most important insights, and give you a real shortcut to being well-informed about what is undeniably a common and often challenging issue for horse owners and enthusiasts.
So let's unpack this high-stress hub. When we talk about the fetlock, we're referring to the metacarpo or metatarsophalangeal joint,
MCPJ, or MTPJ for short, yeah.
often called the horse's main ankle joint in layman's terms. What's striking right from the start is that it boasts the greatest range of motion of any equine joint.
It really does. That's a key point.
And it's that very flexibility, that incredible mobility that, well, makes it so susceptible to injury and wear and tear.
Exactly. That susceptibility comes from the immense forces it endures. I mean, imagine constant hyperextension, high compressive loads, and twisting or torsional forces,
Wow.
especially during intense exercise like racing or jumping. These forces are precisely why issues arise.
Okay.
And when we talk about chronic problems in this area, you'll often hear the term oscillates.
Oscillates, right.
This isn't just a fancy name. It describes that noticeable thickening or bony enlargement you see around the joint, directly associated with inflammation of the joint capsule and lining, what we call synovitis and capsulitis.
So it's like the body reacting to that stress.
Precisely. It's essentially the body's response, a visible sign of chronic stress on that joint.
And while the fetlock is a vulnerability for any horse, regardless of breed, your sources really highlight that it's most prevalent in race horses and elite performance horses.
Yeah, that's where we see it most often.
It makes perfect sense given the sheer repetitive forces they put through that joint day in and day out.
Mhm.
But what about the weekend warrior horse? Are they truly immune?
That's an excellent point. While the severity and maybe the frequency might be higher in elite athletes, no horse is immune. Definitely not.
Okay.
A trail horse or a pleasure horse can certainly suffer fetlock issues from, say, a bad step, trauma, poor conformation, or even just general wear over a longer lifespan.
Right, maybe not the same acute injuries, but still problems.
Exactly. Perhaps not the acute, high-impact fractures you might see in a racehorse, but the underlying principles of how the joint responds to stress, they remain the same.
So for any horse owner, recognizing signs of a problem is the crucial first step. What are we looking for if we suspect an issue with the fetlock? Are there subtle cues, maybe?
Absolutely. And the signs can be quite variable, from very subtle to overtly obvious. Lameness is certainly the most common indicator.
Okay.
And interestingly, it's often bilateral, meaning it might affect both front or both hind limbs, even if only one limb seems more visibly sore to the owner.
Huh, both sides. That's interesting.
Yeah. Beyond lameness, you might feel heat or pain around the joint or notice what we call synovial distension.
The swelling.
Exactly, that visible swelling around the fetlock due to excess joint fluid. For an owner, it often feels like a soft, squishy balloon, sometimes warm to the touch, sort of bulging out from the joint capsule.
And beyond the visible swelling, what else might you notice? Maybe when the horse moves.
You'll frequently observe a stiff, maybe stilted gait and a shortened stride as the horse tries to minimize painful movement.
Trying to protect it.
Right. And if a veterinarian examines the horse, they might note resentment, maybe a decreased range of motion when trying to flex the fetlock joint.
Like, don't touch that.
Exactly. It's the horse's way of saying, no, that hurts.
Okay, recognizing those signs sounds like the first crucial step. But once you suspect something, the real challenge begins. Figuring out what's actually causing that lameness or swelling. We've talked about intense exercise and poor conformation being common culprits, but your sources go deeper, revealing a fascinating array of specific conditions. Could you walk us through some of the major categories?
Of course. And what's truly fascinating here is the sheer number of things that can go wrong in this one joint. It's quite complex.
Seems like it.
Broadly, we're looking at everything from acute sudden injuries to chronic progressive diseases and even developmental issues in younger horses.
Okay, let's start with the acute stuff. What falls under that?
Okay, acute injuries. This includes things like intra-articular osseous fragmentations, think tiny chips or cracks.
Bone fragments inside the joint?
Precisely. Small pieces of bone breaking off inside the joint, or actual fractures in key areas like the end of the cannon bone, the pastern bone just below the fetlock, or those crucial proximal sesamoid bones at the back of the joint.
Sesamoids. Yeah, I hear a lot about those.
Very common in high-speed disciplines, and they typically cause severe, sudden lameness. We also see trauma that can lead to subchondral bone injury that's damage to the bone just beneath the cartilage, or even complete luxation where the joint actually dislocates.
Ouch. Okay, so those are the sudden dramatic ones. What about developmental issues? You mentioned OCD.
Right, developmental orthopedic diseases like osteochondrosis or OCD. What's often overlooked with OCD is that it's not just an injury from intense work later on.
It starts earlier.
Yes, it's a developmental issue. It really highlights how crucial proper nutrition and growth management are in young horses, even before they start serious training.
That's a really important point for breeders and owners of young stock.
Absolutely. And finally, the often more insidious chronic conditions. This includes osteoarthritis, OA, or degenerative joint disease, DJD.
The wear and tear arthritis.
Essentially, yes. As we discussed, osselates, that bony enlargement, are often the chronic form of osteoarthritis in the fetlock. This is where the joint cartilage itself starts to break down, leading to ongoing inflammation and pain.
And things like synovitis.
Right. Synovitis and capsulitis, just simple inflammation of the joint lining and capital, are often early precursors to OA, but they can also be acute flare-ups.
So it sounds like we're talking about everything from tiny bone fragments to the joint sort of breaking down over time. But what about the structures around the fetlock? Ligaments, tendons.
Absolutely critical. They are definitely common culprits, too. The fetlock joint relies heavily on a complex network of soft tissues for stability. Makes sense.
So we frequently encounter various ligament and tendon injuries. For example, suspensory ligament desmetus inflammation or injury to that big ligament running down the back of the cannon bone.
Heard of that one, too. Also, collateral ligament injuries on the sides of the joint, or digital flexor tendinitis, affecting the tendons at the very back of the limb that help bend the foot. There is also palmar annular ligament desmetus, where a specific ligament thickens and can kind of constrict the tendons passing through.
Wow, a lot can go wrong there.
It really can. And then there's one more we absolutely have to mention. Septic arthritis or infectious arthritis.
A scary one.
Exactly. This is a true emergency. It's a bacterial infection inside the joint, usually from a penetrating wound like stepping on a nail or even sometimes from a contaminated injection.
And that needs immediate attention.
Immediate, aggressive veterinary attention to save the joint, and honestly, sometimes even the horse's life. It's that serious.
Okay, that's an incredible array of conditions that can affect just this one joint. This raises an important question. With so many potential issues, how do vets navigate that diagnostic maze and zero in on exactly what's going on?
Yeah, it's definitely a puzzle, and it starts with a systematic approach. You don't just jump to conclusions. The first step is always a comprehensive lameness examination. This involves taking a really detailed history from the owner. When did it start? How bad is it? What makes it worse?
Getting the full story.
Exactly. Then a visual assessment of the horse at rest and in various gaits walk, trot, maybe canter, often on different surfaces, like soft ground versus hard ground, looking for subtle head bobs, hip hikes, asymmetries.
Things an untrained eye might miss.
Often, yes. Then comes careful palpation, feeling the joint and surrounding structures for heat, swelling, or pain responses, and assessing its range of motion passively. Finally, a series of flexion tests are performed.
Holding the leg bent for a bit, then trotting off.
That's the one. But, when I was reviewing the material, a crucial point about those flexion tests really stood out. Could you elaborate on why a positive response isn't always the whole story for pinpointing the fetlock?
Ah, yes, that's an excellent observation and a really vital piece of information. A positive response to a lowered limb flexion test, meaning the lameness gets worse after holding the joint flexed. It may be a false localizing sign.
False localizing. Meaning?
Meaning the pain could actually be coming from above or below the fetlock joint. But the flexion test, because it stresses the entire lower limb, makes the fetlock appear to be the source.
I see. So it narrows it down but doesn't confirm it definitively?
Exactly. It tells you there's likely a problem in that area, but it doesn't definitively confirm the fetlock as the sole source of pain. You need more diagnostic steps to be sure.
Which brings us to diagnostic anesthesia, right? Nerve blocks and joint blocks. How do those help confirm the source?
Yeah, this is often the next crucial step for precise localization. We use nerve blocks first, where local anesthetic is injected around specific nerves to desensitize a region, starting low down and working up the leg.
Numbing specific areas.
Right. If the lameness significantly improves after a particular block, it helps us pinpoint the area of pain. For the fetlock specifically, though, an intra-articular block is even more definitive.
Injecting right into the joint.
Correct. Local anesthetic is injected directly into the fetlock joint space. If the lameness resolves or significantly improves after that, it confirms with high certainty that the pain originates from within that joint.
Okay, that makes sense. Once they've localized the pain to the fetlock, imaging must be key to seeing what's actually damaged inside. What are the main tools?
Exactly. Imaging is critical. Radiography or X-rays is typically the first go-to. It's excellent for identifying bone abnormalities like fractures, signs of osteoarthritis, such as bone spurs.
Osteophytes.
Right, osteophytes, joint space narrowing, changes in the bone beneath the cartilage, that sort of thing.
But they have limitations.
They do. It's crucial to understand that in early or acute disease, radiographs may appear completely normal.
Why is that?
Because soft tissue changes, or very subtle bone damage, or early cartilage damage aren't always visible on X-ray yet. Chronic signs, though, like widespread periarticular osteophyte formation, loss of joint space, bone sclerosis, those definitely show up.
So if X-rays are normal, but the horse is still lame and blocked to the fetlock,
Then you move on. Ultrasonography becomes invaluable, especially if soft tissue damage is suspected. It excels at visualizing soft tissues, tendons, ligaments, the joint capsule, and even assessing the quality of the synovial fluid.
good for looking at those ligaments and tendons we talked about.
Precisely. For even more detailed assessments, especially for subtle or complex injuries involving both bone and cartilage, MRI, magnetic resonance imaging, and CT, computed tomography scans, are invaluable.
Really high-tech stuff.
Yeah. MRI is often considered the gold standard for soft tissue detail, looking at cartilage, subchondral bone problems. CT gives incredible 3D bone detail, which is fantastic for planning surgery for complex fractures.
And bone scans. Nuclear scintigraphy.
Right. Nuclear scintigraphy or a bone scan can detect areas of increased bone turnover or inflammation that show up as hot spots. This is useful if you suspect something subtle, maybe widespread, or if you're trying to differentiate between multiple potential problem areas.
So a whole arsenal of advanced tools. Are there any other diagnostic procedures if those aren't entirely conclusive?
Yes, a couple more. Arthroscopy, which is essentially keyhole surgery.
Going in with a camera.
Exactly. It allows for direct, global visualization of the articular cartilage and any lesions inside the joint. It's minimally invasive and provides, unparalleled detail of the joint surface itself.
And can sometimes be therapeutic at the same time?
It can. We'll get to that. And for suspected septic arthritis, which, as we emphasized, is that serious emergency synovial fluid analysis is essential.
Taking a sample of the joint fluid.
Correct. Collecting joint fluid and analyzing its cell count, protein levels, its appearance, and most importantly, culturing it to identify any bacteria present and figure out which antibiotics will kill them.
Crucial for infection.
Absolutely.
And if a vet were to examine tissue at a pathological level, say during surgery or postmortem, what might they confirm?
At that microscopic pathological level, findings might include that periarticular osteophyte formation, those bone spurs or thinning cartilage, maybe cartilaginous fibrillation, where the cartilage surface looks sort of frayed or roughened up.
Damage to the smooth surface.
Right. They might also see osteochondral fragmentation, an enlarged dorsal synovial pad, which is part of the joint lining, and changes in the bone beneath the cartilage, either subchondral sclerosis, where the bone gets abnormally dense and hard, or lysis, where it's actually breaking down.
So confirming the disease process visually?
Exactly. These findings confirm the type and extent of the disease process at the tissue level.
Okay. So once a vet has navigated that diagnostic maze and pinpointed the problem, that's when the real work begins, isn't it? What are the various strategies for getting these incredible athletes sound again? This sounds like where it gets really interesting.
It absolutely is, and it's so important to stress that management is highly individualized. There's really no one-size-fits-all solution.
Depends on the horse, the problem, the job.
Exactly. It depends entirely on the specific diagnosis, the severity, and crucially, the horse's athletic goals. What does the owner want this horse to be able to do? We often start with conservative, non-surgical approaches.
Like what?
This includes essential rest, sometimes stall rest, sometimes just turnout, and then controlled exercise, gradually increasing. Cold therapy, like icing or cold hosing, to reduce inflammation, and compression bandaging for support and reducing swelling.
The basic building blocks of managing inflammation.
Precisely.
And what about medications? What's in the veterinary toolkit to help from the inside out?
Systemic medications are very common. We use NSAIDs, non-steroidal anti-inflammatories like phenylbutazone or flunixin, meglumine, banamine for pain and inflammation. They work throughout the body.
Similar to how we might take ibuprofen.
Exactly. Then there are compounds aimed more specifically at supporting joint health. Polysulfated glycosaminoglycans, PSGs, like the brand Equine, can be given intramuscularly or sometimes directly into the joint. They're thought to help protect cartilage.
And hyaluronic acid, HHA.
Right, hyaluronic acid, HA, like the brand legend, can be given intravenously or also intra-articularly. It's a component of normal joint fluid, so the idea is to improve the quality of the joint fluid, acting as a lubricant and having some anti-inflammatory effect.
And what about all those oral supplements you see? Glucosamine, chondroitin.
Yeah, oral joint supplements. There's a huge market for these containing ingredients like glucosamine, chondroitin sulfate, MSM, HA, omega-3s. While the hard scientific evidence for some of these is still debated or building.
Anecdotal reports are common, though.
Very common. Many owners report anecdotal benefits, especially for long-term maintenance and potentially slowing progression, but it's less proven for acute issues compared to, say, NSAIDs or joint injections.
Okay. It strikes me that with all these internal joint issues, external factors like how the horse's foot is managed must be incredibly important. Does the farrier play a significant role here?
That's an astute observation, and absolutely corrective theory is vital. It can be a game changer.
How so?
Proper trimming and shoeing can dramatically reduce abnormal forces on the fetlock joint. A skilled farrier, working with the vet, can use specialized shoeing techniques, maybe different shoe types, pads, or trimming angles, to alleviate specific stress points, redistribute weight more evenly, and promote proper limb alignment.
So optimizing the biomechanics.
Exactly, which can be incredibly helpful in managing chronic fetlock issues.
Beyond systemic medications, what about direct injections into the joint itself? Are those the heavy hitters for localized problems?
They often are, yes, particularly for tackling localized inflammation effectively. Intra-articular corticosteroids are potent anti-inflammatories.
Steroids.
Right, steroids. They're highly effective at reducing pain and inflammation directly within the joint capsule. However, it's crucial to be aware of their potential downsides.
Such as?
Well, they're generally not recommended in horses with a history of, or high risk for, laminitis. And there's an ongoing discussion and some evidence pointing towards potential for long-term cartilage degradation with certain types, like methylprednisolone, especially if used repeatedly or at high doses.
So a balancing act.
Very much so.
Yeah.
Use them judiciously. Hyaluronic acid, IAAHA, is also frequently injected into the joint, sometimes on its own, sometimes combined with corticosteroids, again aiming to improve lubrication and reduce inflammation.
And then there's the cutting-edge stuff, the biological and regenerative therapies. That seems to be a growing and very exciting area.
It really is. It's a rapidly expanding field, and the goal here is often different, aiming to promote actual tissue healing and regeneration, rather than just masking pain or inflammation.
What are some examples?
Well, there's platelet-rich plasma, PRP, which uses the horse's own blood, concentrates the platelets and their growth factors, and injects that back into the joint or lesion to stimulate healing.
Using the body's own healing mechanisms.
Exactly. Then there's stem cell therapy, using mesenchymal stem cells, often derived from bone marrow or fat. These are employed for their anti-inflammatory and potential regenerative properties.
Okay.
We also have things like interleukin-1 receptor antagonist protein, IRAP, or sometimes called autologous conditioned serum, ACS. This process isolates and concentrates anti-inflammatory proteins from the horse's blood to block specific inflammatory pathways in the joint.
Like turning down the inflammation signal.
Pretty much. And similar is autologous protein solution, APS, like the product Prostride, which concentrates both anti-inflammatory proteins and anabolic building growth factors. And a newer option is polyacrylamide hydrogel, like Arthrimid Vet. It's an inert hydrogel injected into the joint that integrates with the joint lining, aiming to improve lubrication and provide a sort of supportive scaffold.
Wow, lots of different approaches there. Are these becoming more mainstream?
Some more than others. PRP and IRAPAFs are quite common now. Stem cells are used frequently, but can be more costly. The hydrogel is newer but gaining traction. Availability and cost still vary, but the trend is definitely towards using these regenerative options more often.
What if these conservative or injectable treatments aren't enough, or if there's a specific structural problem like a large chip fracture that needs to come out? That's when surgery comes into play, right?
Exactly. If there's something physically wrong that needs fixing, or if medical management fails, surgery is the next step. Arthroscopy, or keyhole surgery, is a minimally invasive and incredibly valuable tool.
We mentioned it for diagnosis.
Right, and it's often used for treatment, too. It's commonly used for removing chip fractures or OCD fragments, cleaning up damaged cartilage, debridement, or for lavaging, that means flushing out infected joints, particularly in cases of septic arthritis.
So cleaning things up inside.
Precisely. For more significant issues, like complex fractures of the sesamoids or the end of the cannon bone, surgical fixation with screws and plates might be necessary to stabilize the bone and allow it to heal properly.
More invasive, but sometimes required.
Definitely.
And if all else fails, if the joint is just too damaged, too painful, there's a procedure that sounds quite extreme but can be a horse's last chance for comfort. Arthrodesis.
You're right, arthrodesis, which is joint fusion. This is truly considered a salvage
The
procedure.
last resort.
Absolutely. Typically reserved for severe end-stage osteoarthritis where the cartilage is gone and the pain is unmanageable, or for catastrophic irreparable injuries like severe fractures or ligament ruptures.
What does it involve?
It involves surgically removing any remaining cartilage and then using plates and screws to rigidly fuse the bones of the joint together so the pastern bone fuses to the cannon bone.
Eliminating movement.
Exactly. It eliminates motion and therefore eliminates the pain associated with that motion. After arthrodesis, horses obviously can't perform athletically on that limb again, but they can often be pasture sound, meaning comfortable enough for turnout or potentially used for breeding.
So it gives them a comfortable retirement, essentially.
That's the goal. Comfort and quality of life when other options are exhausted.
And finally, once treatment is done, whether it's medical or surgical, rehabilitation must be absolutely crucial for recovery and getting these horses back to whatever their new normal will be.
Oh, it's not just crucial, it's often the make or break phase. You can have the best surgery in the world, but without proper rehab.
It won't succeed.
Exactly. Rehabilitation involves a careful, gradual return to work. It starts with strict rest, then controlled hand walking, maybe some underwater treadmill work, and progressively increasing activity levels as the joint heals, all guided by veterinary rechecks.
And physical therapy.
Yes, physical therapy plays a vital role. This can include passive range of motion exercises, stretching, and various therapeutic modalities, like therapeutic ultrasound, extracorporeal shockwave therapy, ESWT, cold laser therapy, magnetic therapy, all aimed at promoting healing, reducing inflammation and scar tissue, and restoring function.
Sounds intensive.
It can be. Supportive boots or bandages are also often used during the initial recovery phase, or sometimes for ongoing support during exercise later on.
Okay. If we connect this to the bigger picture then, managing these conditions, especially the chronic ones like OA, it sounds like it's often an ongoing journey.
That's a great way to put it. It's rarely a one-time fix, especially with chronic issues like osteoarthritis. It requires vigilance and a real commitment from the owner to long-term care.
So after all these interventions, what does that long-term management look like, and what can owners truly expect for their horses, prognosis-wise?
Patient monitoring is absolutely key. Continuously looking for any return or worsening of joint swelling or subtle changes in gait, and performing periodic lameness evaluations as needed or before increasing work.
And the likely outcome?
The prognosis really depends heavily on the specific condition, how severe it was, and crucially how early it was recognized and treated. Early recognition and a good response to initial treatment can certainly prolong a horse's athletic career, maybe for years.
But maybe not forever at the same level.
Often, yes. It's important for owners to have realistic expectations. Osteoarthritis of the fetlock joint is a progressive condition. It'll likely worsen over time, maybe slowly, maybe faster, and some reduction in athletic soundness is generally expected eventually.
And after arthrodesis?
After an arthrodesis, as we discussed, horses may be salvaged for breeding purposes or retired to pasture for a comfortable life, but athletic work involving that limb is generally out.
Okay. Beyond treatment, what about prevention? This is huge. Can owners do anything to avoid or at least minimize the risk of these debilitating issues in the first place?
Absolutely, and prevention is paramount, though not always possible to avoid completely. A key factor is appropriate training and conditioning for the horse's intended sport-building strengths and fitness gradually, not pushing too hard too soon.
Letting the body adapt.
Exactly. Early recognition and timely treatment of any acute disease, even mild swelling or lameness, are crucial. Addressing problems quickly can prevent them from becoming chronic and far more difficult or impossible to manage effectively down the line.
Nip it in the bud.
Precisely. Your sources also specifically recommended avoiding horseshoes with toe grabs, particularly on the front feet, as these can significantly increase stress and hyperextension at the fetlock joint during high-speed work or push-off.
That's a specific, actionable point.
It is. Sometimes a strategic reduction in workload or a shift to an alternative, less strenuous sport can prolong an athletic career, albeit maybe at a lower competitive level, keeping the horse comfortable and useful for longer.
Adjusting expectations to prioritize the horse's soundness.
Right. And then there's just good, solid horsemanship. Regular veterinary checkups, especially for performance horses, are essential to catch subtle issues early before they become big problems.
Preventative care.
Yes. Good foot care with regular and correct farriery is absolutely fundamental for proper biomechanics and reducing abnormal stress. Balanced nutrition, particularly avoiding overfeeding young, rapidly growing horses, helps prevent developmental orthopedic diseases like OCD that can predispose them to fetlock issues later.
And things like footing, weight.
Critical. Ensuring suitable footing for exercise, not too hard, not too deep, consistent, reduces concussion and the risk of acute injuries. And finally, maintaining a healthy body weight for the horse reduces the overall stress load on all joints, including the fetlock. It seems basic, but it's incredibly important.
So what does this all mean for us? It's really clear that keeping these amazing animals sound, especially at high levels, takes incredible dedication, a deep understanding of their unique anatomy and the stresses they face, and a very proactive approach to their care.
Absolutely.
Yeah.
The fetlock joint is truly a testament to both the incredible evolutionary design of the horse and, simultaneously, the inherent challenges that come with pushing such powerful biological machines to their limits.
Indeed. We've talked about the incredible forces the fetlock joint endures daily, and thankfully, the quite advanced medical and surgical options now available to help manage the consequences.
Considering all of this, the forces, the potential for injury, the treatments, what responsibilities do we as humans have in balancing the athletic potential we ask of a horse with their long-term welfare and comfort? It's a question that I think resonates deeply when you consider the partnership we have with these magnificent animals.